Good afternoon. I'm Lisa Arthur, Senior Vice President of North America and APAC and Global Chief Marketing Officer here at Sensedia. Welcome, and I'd like to also thank our sponsor, Zappts, for making this podcast possible here at APIX in São Paulo, Brazil. Today we have an episode focused on one of the most complex tech problems in the modern world: healthcare interoperability. And I know it's a hot topic in the US. What we're talking about is how to move past data silos to actually save lives and to improve the patient experience, because that's really what it's all about. We're lucky enough to have two guests to help tell the amazing story of Liberty Health and how they did just that. We're going to be talking with Marcelo Biangulo, CTO of Liberty Health, and Sensedia's own Filipe Torqueto, Head of Solutions and US Solutions as well. What I'd love to do, gentlemen, is to dive in and have you both introduce yourself so our audience can get to know you as well as I, and then we'll jump into the conversation. Marcelo, will you kick us off?
Hi, my name is Marcelo Biangulo. I am Chief CTO at Liberty Health, Brazilian health tech specialized in digital transformation in public healthcare sector. At Liberty Health, our mission is improve healthcare and impact lives, saving lives. And our several years, we have worked with large public healthcare and network, helping government and connect fragmented information and accelerating and improve the quality of the attendant. Thank you.
Thank you, and I can't wait to dive into that. Welcome.
And I am Filipe Torqueto. I'm the head of solutions for Sensedia and also the solution architect for the US market, and helped a little bit lead Liberty Health here with their products. And also we attend a lot of healthcare providers here in Brazil, so interoperability is something that we know a little about.
And I know our audience can't wait to talk more. I know in the US, it's a huge focus with a lot of deadlines coming up. So let's dive in. And one of the things that I opened up with was this silo problem. Marcelo, I'd love to start off with you. You stepped into a situation in São Paulo involving 7 million people and hundreds of facilities, I think over 350 to be exact. What did the landscape look like before you and Sensedia got involved?
Before the project, the healthcare ecosystem is highly fragmented. Each hospital, emergency unit, clinic, and prime care center operate with isolated MR systems. Patient information was scattered across 100 systems. Physicians had only part of the information they need for chaos. Resume was chaos.
It sounds like it.
The worst part was basically the information that we were looking for was spread out, and not just spread out, but they have silos with very important information that needs to stick together. So, for example, we do have fragmented patient information. It's not just that the patient information is fragmented for no reason. The patient fragmented information will deliver delays in the diagnostics. So this is the key part. We're losing key time here. So it's not just that, okay, we do have silos for the data and this data needs to be joined together. It's the way that the data needs to be joined is the key as well. So Liberty got a very huge challenge in hand with the amount of stuff that is going on.
And I would imagine that that scenario of kind of a hairball of data, because it's coming from all over, is like most healthcare companies. Is that true? Liberty Health had a bad mess to untangle, but many others share that same mess. Is that true?
Yes. And very a lot of systems in paper.
Oh, paper.
And paper. Sometimes the patients get out of the attendant of physician with paper for retire the
Medication.
medication. So interoperability helps the organization, less paper, fast. They get what they need.
Yeah.
So they have a lot of paper in hospitals in general, right? So the physician is doing things on paper, and everybody in the pharmacy is doing things on paper as well. So more than just a silo data, the data is unreachable because it's literally paper. So the digitalization perspective is also an issue. So it's more than just, okay, we do have silos, we do have multiple, parts of the physician stuff that you need to go through, which is clinics, big hospitals, smaller hospitals, pharmacies, and personal clinics, public clinics. So everybody have a specific paperwork. And what I mean paperwork is literally paperwork.
Yes.
So the first glance was, okay, let's digitalize everything. And after we go, okay, with this digital data
How
siloed,
connected this?
we need to connect the data. So this is
Well, you can tell it was definitely a team effort and one that was required. Now, I think one of the things that makes it really complex for healthcare organizations is the highly regulated industry of healthcare, right? So I'd love to talk a little bit about that. Marcelo, you guys decided to follow the RNDS, the National Health Data Network model, using HL7 FHIR as the standard. I think it's really important for our U.S. audience to understand that choice. Why was FHIR so critical?
In middle of the chaos, have good news. FHIR and all of actual technology, it's possible we can resolve these issues. So the second problem is culture and people accept just change.
Mm-hmm.
For use FHIR, AL7 FHIR, we need just MR systems, for example. Change information, how they input information. So it's big challenge. But like I said, it's good news for technology. We have Sensedia help us, and FHIR is universal language, so tested and proved it works. So it's no in doubt. It's FHIR is the best way.
Mm-hmm. Mm-hmm.
So more than just a protocol, right? So FHIR, you do have FHIR and you do have HL7. But when you're going to deep dive in the healthcare ecosystem, you're going to see not just the clinics, the hospitals, and the pharmacies. You need to deep dive with EMR systems that here in Brazil we do have many, in the US we do have many as well. And now we are bearing the same old problem, which is who owns the data and where the data is going to be, exchanged with. So FHIR is the protocol that unifies it. Very good, battle tested, but FHIR is complex, right? And for example, I'm just out of a regular exam with EMR, right? With my physician. They requested deep dive, examinations and more tests. Those test results needs to be in the same standard to exchange information into my protocol to have my data unified. So it's not just, EMRs in hospitals. This is going to be extended to equipment retailers, to EMR providers, to pharmacies, to everybody in the chain. So healthcare, in terms of chain, is a very big iceberg of complexity. Yes. I love icebergs, as you know. So it's a very big
outside.
Yeah, it's very tiny and outside. Okay, I'm going to the hospital. I need my data in the hospital. This is, the smaller part. You need every
Yes.
test result, every blood test. If you broke something, if you have a disease, if you have a chronic disease, where is your history? And your history can be, and it is fragmented. So we bring this up all together. FHIR to help us, and Liberty took this long journey to first get everybody together, and then get this thing disseminated through not just the institutions that took care of the patient, but the institutions that do the software to take care of the patient. So if you're going to be in a hospital, you have data everywhere. So you draw a blood test, you make a simple consultation with your physician, or you stay in an ICU. So you guys imagine how many data you have in an ICU. So everything's FHIR in HL7.
It's a lot of context.
Yeah.
This biggest difference in open finance and another markets, because in open finance your interoperability is numbers.
Yes.
Is most of data. In health, it's context. It's not so simple. The
Yeah.
data.
Well, and one missing data point could mean a person's life, which is really scary, and it underscores the importance.
It's another big problem is in finance. If leak of data, you just drop your credit card,
Yep. And get order.
Get an order.
Yeah.
If leak your data,
Not much of an option.
yes.
Well, and from what it sounds like, even though FHIR is complex, it then simplifies the aggregation of that view of the patient, so the patient gets that better healthcare and experience.
Traditionally, healthcare integrations involve length analysis, custom mappings, and extensive manual development. In these projects, I believe we combined it with Sensedia API, managed platform with AI. Artificial intelligence is here to help us. Principle with the large of data and organize this, accelerate a lot. AI helps us to analyze software, structure, subjects, better ways for we can handle of it.
Much more holistic.
Yeah.
Very interesting. Now, listening to this, and you just mentioned AI, so I'd love to kind of, not that that's not a hot topic here, right? Today, I think everyone's only talking about that. But you made a quote recently that jumped out, and I want to share it with our audience, and then have you expand upon it. You mentioned that a project like this would usually take 8 months, and to me, hearing the complexity, that would even be fast. However, your project was done in 2 weeks.
Yes.
Now, obviously, it was a team, but you're also using AI for this. And so I'd love to hear how you accelerated that quickly.
Yes. Like you said, normally it required months to do that, and AI help us shortly in 2 weeks, because it's a lot of data for human organized. All of this AI make it so fast. And check numbers and information. Agents working together. Agents for data of the emissions. Another of agents for data of the billing. Another of agents for data of the magicians. So it helps us to improve and accelerate a lot.
That's
Remember the
amazing.
papers? So
Yeah.
AI is very good to build interpretations, right? So papers are, the same old paperwork that you go through. So AI to make this interpretation and make at least this digital was a huge accelerator back then. And another thing is FHIR. FHIR is a standard, right? AI is extremely good to, advance it and do the interpretation of the standards. So to use AI with FHIR and accelerate the FHIR implementation was a key stuff, because basically you are presenting to the AI, which is pre-trained on FHIR, and say, hey, this is the unformatted data. So how I can, translate this to FHIR. And of course, it's not just the translation. You need to do the translation and make it repeatable.
Mm-hmm.
But the part to do it repeatable, Sensedia platform covers, and that's fine. But the work that you need to do between uninterpreted data and unformatted data to use AI to format it into FHIR, it's extremely accelerated by AI. And more than that, you can reuse it. So FHIR is FHIR. So if your EMR have a specific standard, you need to translate to FHIR. If somebody or someone else needs to do the same work, it's the same old agent, right?
Mm-hmm.
So this is the good part of to have HL7 and FHIR, because you can use AI to do what AI
Mm-hmm.
is supposed to do, which is standardization. So it accelerates us very big. It eat a lot of the time of the project because of it. So one thing that we need to do and build manually all the forms and everything, even in paper, we accelerate it with multiple agents. One agent to read the paperwork literally, which is taking a picture, read it, and make it digital. But the fact that is making digital into HL7 with FHIR already. So the work is just to repeat.
Mm-hmm.
This was the magic.
Well, I think it's a really great use case of one, AI not taking away jobs and roles,
Yeah.
but playing a very
Yeah.
critical role to help people go faster.
Yes, absolutely.
Did you have any obstacles in the buy-in of using AI, or was it just, yeah, we got to get there fast, let's do it?
I think the biggest challenge is the fear of the people lost their jobs. And so they refuse in first moment. But with time, they see the AI is here for help and accelerate. So actually, at Liberty Health today, almost of entire team using AI.
Thank you for sharing. I think that's a real inspiration for our audience. And I think that that speed to market obviously is very important. I said in the intro, and I think you mentioned it once, Marcelo, 7 million lives impacted. 370 different facilities integrated, and 872 HHIs. And for our US audience, that's approximately 175 million US dollars increase in billing for the Department of Health.
1 year.
1 year. Torqueto, this time I'm going to come to you first. How does this translate to the US? I mean, those are huge numbers.
First, this is a glance of what the public healthcare system, which is a centralized location of everything, and the private sector working together. So this is the first glance of it. And how we can do that was basically the need for the people itself, not the need of a specific group, right? So the healthcare in Brazil, generally, we do have a mix between public and private, and they mix up. This is a very complex, tailed stuff that mix up. So sometimes some specific procedures are made by the public healthcare, sometimes are for the private healthcare, and this is becoming a nightmare for everybody, for the public sector and for the private sector. So they came together. So this was the first, the first part of it. The second part was unified location. This is extremely important. It's not just one vendor or one EMR or one retailer or whatever the case. This was a general, universal, implemented based on a standard, which is FHIR, and with the SUS, which is the public healthcare provider in Brazil, right? So those are the two keys: the joint stuff with those two organizations, those two big organizations, and the second part is the establishment of the standards itself. FHIR was the standard, but okay, everybody needed to implement. It's not just okay, let's implement in the time that the provider wants to go. No, you need to implement that, otherwise it's impossible to operate. Right? So that's why Marcelo mentioned, okay, you're operating your paper. Imagine COVID era with paper. So it was impossible to go through. So the main reason was it's simply impossible to go through with paper, and the things was, right? In the US, I see a huge opportunity to see the cycle as, okay, interchange data with multiple factors and vendors can benefit the patient, but we need to keep the patient at the first, not the vendor or the data that the patient needs to use, you know? So the patient and the life comes first, not the money that this can generate. So this is, you know, the main reason of it. The patient is always in first, because we need to do what exactly? To save lives faster.
Yes.
So this is, for me, was the key. And this is I never told anything about technology. It's not technology. This is literally the checklist of priorities, you know? So, okay, the patient is here. So what we can do for this patient, because healthcare is not like financial services. When you're going to find a healthcare provider, you are in a fragile situation most of the time. So you don't need nobody to, you know, scratching your personal data to provide you something that you don't need. You're already in a fragile situation. So what you can do. So this is the mindset to develop the solution.
Very interesting.
I think this shows the power of the data and how interoperability and AI can help with the results and better quality of the treatments and the management of their hospitals.
Yeah. In this scenario, and I know we're coming close to the end of our time, given that the US is super focused on healthcare interoperability and being a patient across a couple of medical providers, I can't wait because it's painful physically and emotionally, right? Because to your point, Torqueto, you're often in a fragile stage when you need all that information because you're dealing with something. So my question would just be, what would be your advice to our US executives that are leading this change, because it's a change, as they embark and execute a vision like yours?
Our experience shows the right combination of API governance. Organizations can modernize with faster and traditional ways. So it's big challenge. It's fact. But we need faith for improve the also ecosystem.
Yeah, thank you. That's good advice. Torqueto?
Well, the secret is data, and nobody really wants to share data. Right. Yes. So the main point here is more you share, more this sharing is bringing to you. So if you are an EMR provider, or if you are a big provider that do have a lot of data, sharing the data and to enable other companies and the hospitals and everybody else to, with the shared data, do something with this, do more products and treat patients better, is not going to harm any business model, or this is going to help your business model to do more with that, basically. So don't be afraid to share it. And of course, in sharing, I mean safely share. So data is needed. If you don't have a safe way to share data, they will find a way. since they are scraping data since, I don't know, 2000s, for financial services, they're going to do the same with the healthcare providers. They're going to find a way to scrap the data. It's an unsecure way.
Mm-hmm.
So the main message here is provide the rails for everybody to do it. Otherwise, they will find a way that is not the ideal way.
Mm-hmm.
So provide the APIs in a safe space with the guardrails, the right guardrails to share patient information. And I'm basically in a unique position because I use the healthcare in Brazil and I use the healthcare in the US. So every single clinic that I visit in the US, I need to go through all my stuff again and again and again. Back in Brazil, I don't need it. I just need a card, literally. Marcelo knows that because he implemented it. But anyway, I just need a card. I don't need to tell the doctor what I had. They already know. They already have everything and the information that I need. So this is way faster and more than faster. So I don't need to say to them, oh, I'm allergic, or I had that surgery, or
Right.
if I had something. This can save a life, or this can at least make your trip to the physician faster.
Mm-hmm.
And, again, you're already in a fragile situation. You're looking for help. So to get help faster is always good. So the main message for me is, okay, sharing data is not a harm. Because somebody's find a way.
Yeah.
So enable it, So shared data. This is the main message.
It's a good
Well,
message.
And coming back to your comments earlier, then the patient's experience becomes better. They don't
Yes.
feel like a number anymore. And I know in the US healthcare, you can often feel like a number, like, or a cow maybe going through the yards. But it also is that experience, right, of they know me and it's somebody new. I can even open up and get deeper faster because I know they know me. Really interesting. And I think it's incredible to see how the right technology can turn a massive health challenge into a story of success, scale, and patient health. And Marcelo, Torqueto, I can't thank the two of you enough for sharing these insights. It is clear with the right API strategy, to your point, that 8 months of work really can be a matter of a couple of weeks. And US firms can deliver on a vision that seems difficult to impossible. So thank you for inspiring us. Thank you for both taking time out of our 1,000+ conference here in São Paulo at APIX to talk and inspire our US audiences, and how FHIR and unified data can reshape healthcare. I want to once again thank our sponsor Zappts for making this podcast and all those from APIX possible. We love our partners and we thank you for that. I also thank you for watching in, and if you have any questions, you can tag me or you can tag Torqueto or Marcelo on LinkedIn, because I'd love to see us keep the conversation going. Until next time, thank you. And in our language here in Brazil, muito obrigada. See everyone soon. Bye-bye.